Hi, my name is Felisa Galindo, and I'm one of the clinicians for El Paso Center for Children. I'm part of the El Paso Hopes program, and I want to talk to you today about different tips to handle tantrums. It's important for us to ask, why is my child misbehaving? My child wants something, or is he maybe trying to avoid something? Or is it my child having a sensory issue and is trying to avoid being touched? Or a bright light is bothering him or a loud noise? It's important to understand this to know what to do because it's essential to intervene early as soon as you note any agitation before the child escalates. Normally, children act different from their normal, and that is how we know they're escalating. But what if they still escalate? What can we do? We can remove the sensory stimuli. We can dim the lights. We can lower the volume of electronics. If it's possible, we can also ask people in the room to temporarily leave. We just want to try to avoid excitement to get them upset. Let's validate the child's feelings. Show the child that you understand how he feels by using statements such as, "You feel very angry right now," or "That made you very upset." It's important to provide empathy and understanding with your tone of voice. Doing that conveys support and a willingness to help. How can we help our child express feelings? If your child is verbal, help and tell you what got him so upset so that you can understand and help. If your child is verbal but too angry to talk, reassure him that you are there for when he's calm and ready to talk, maybe about it a little later. If your child is nonverbal, you can offer a hug. But if your child is not ready for a hug, that's okay too. Offer comforting words, telling him that you care about his feelings. We have to reinforce the positive behavior. Praise your child for positive behavior, such as calming down. You need to make eye contact with them, using words to express themselves, taking deep breaths. You need to avoid scolding your child for negative behavior, such as using inappropriate language, screaming, yelling. This is not the appropriate moment to address those behaviors. Use redirection. Be a guide. Instruct your child about what to do, not what to stop doing. For example, say, "Please hand me the toy." Please lower your voice to an inside voice. Be polite and use words such as please, thank you. Don't be bossy, but be firm, but be a gentle guide. Avoid telling your child what not to do. Never say, "Stop throwing that," "Quit your crap," "Stop yelling." Use a low tone of voice, even whisper when redirecting. If this is possible, change caregiver is available, okay, and is appropriate. Switching to another adult to handle the situation can be helpful sometimes. Ask your child if he wants or if he might feel better with a different person, but only use this strategy when you have another person who can help. Have the alternative caregiver help the child calm down. And once the crisis has de escalated, you can come back and finish the discussion with the child. But what if even this fails? Well, as the adult in charge, you need to take a deep breath and withhold your attention and simply wait. But keep an eye on the child for as far as you can. Yet make sure the child is safe. Inform your child that you are there to talk when she comes down and is ready to do so. Make it look as if you have other things to do or pretend to. Go and go on with your day. Be patient. Stay calm. If you act like you have nothing else to do all day long for your kid to de escalate, he will most likely calm down in a few moments. But if you become agitated, your child will sense it and it may take all day to de escalate him. And just some final points. Remember that we as caregivers, we need to be really careful in how we react verbally and non-verbally to a tantrum. We need to direct and we need to help our child de-escalate. Remember, as grown-ups, we need to remain calm, even if the child is not. We cannot control the child's action and words, but we can certainly control our reactions, words, and body language. Avoid the power struggle. You are in charge already, remember, don't forget that. When a child perceives an adult as a threat, he is more likely to become scared or agitated. As soon as the child comes down, the best thing to do is to let her go back to her normal routine. Given that it is safe, scolding at the time can reignite the fire. Try to stay out of the motion and into a thinking mode. And when you want to talk to your child, you can kneel down and talk to the child at his level. Once you are resolving the issue with a talk or a hug. Thank you for your time. And remember, you can do this. This stage would be over before you know it. Enjoy the blessing of being a parent and a caregiver. Have a nice day.